Good morning, America. This is Dr. Rickredalen, the Maverick Doctor, and I'm going to talk to you a little bit today about the drug crisis going on in America. When we talk about drug crises in America, we can talk about numerous subjects, and each one of them should bring our attention to them. We have the highest drug costs in the world. We use more drugs than any other country in the world per capita. How do we change these things? Why is the United States such a drug-dependent society when our country uses about half of the pharmaceuticals produced in the world? And when it comes to illegal pharmaceuticals, we use 85 to 90% of that, depending on whose statistics you read. What do we do to change all this? How does all this happen? In the United States, our senators and representatives receive less than $200,000 a year per person, as does our president. Why does that lead to the growth of the multimillionaires in our congressional leaders? It's hard to say. But we do know one thing: when it comes to pharmaceuticals, over $200 million was spent on our congressional leaders over the past 2 years for lobbying for them. In fact, for every dollar spent on our congressional leaders to get them reelected, which is paid by the giant pharma, $7 is paid for lobbying. Pretty startling statistics, huh? So our congressional leaders, which seem to sometimes get a little greedy, being they take all these, I'm going to call them bribes, from big pharma, seem to want to supplement their income. Why would they do this? Is nearly $200,000 not enough to live on, or is it just that big pharma does so many wonderful things for them that they just can't afford to pass it up? And why, when big pharma gives our congressional leaders money to influence the drug laws, none of them for the good of the people, but all for the good of big pharma, why is it that we put up with that? What is going on that we think we have to do that? And why should they do this? For example, a law was passed a little while ago that weakened the DEA, and I'm going to be reading this to you rather than going from just memory. Senator Orrin Hatch introduced the law in February 12, 2015. He received nearly a couple $100,000 for just the work on that. Now he can say he did other work for other drug companies, but actually that is a dollar amount he received. Tom Marino, who was going to be our next drug law, received $100,000 from political action committees. And when this was brought to the light of the American people, he of course was not selected as our next drug czar. Both Orrin Hatch and Tom Marino helped pass laws that made it so our DEA would be less effective in controlling illegal use of narcotics. I'm going to read this to you. The United States has a law regarding controlled substances that gave the DEA authority to register manufacturers, distributors, and dispensers of controlled substance. And they were to register any kind of activities that would appear to be against the American taxpayer. The law, introduced by Orrin Hatch in 2015 and supported by Tom Marino, revised this. The bill revised and expanded the required elements of an order to show cause issued by the DEA before it denies, revokes, or suspends the registration for the Controlled Substance Act violation. This was an order to show cause must specifically state the legal basis for the action and notify the registration of the opportunity to submit a corrective action. So not only did we warn the big drug companies like McKesson, we gave them time to submit a corrective action. Their response pretty much was to this, I'm going to boil this down into, we're here to sell drugs, we're not here to control how they're used. Point made. What can we do to stop the illegal use of drugs and support the use of lower drug prices? I guess we have to just stop supporting big pharma. And that's what we all should look at doing. We'll need to live healthier lives and depend less on pharmaceuticals to get us where we're going. This is Dr. Rickredalen, the Maverick Doctor, talking to you about some of the drug problems in the United States. I hope you will take heed, write to your congressional leaders, and ask them how much money they receive from Big Pharma and what is their payoff for making sure Big Pharma gets the good deals and not the American people. God bless you and have a wonderful day.